record it. And this is Dr. Garais, MED240, and this is the review for your midterm. Thank you. I need a reminder what am I talking about. Now, if you look at all these lecture notes, which were the lecture notes that I went over? Evolution of medicinal drugs, basic concepts of pharmacology. Now, did I go over these? No. These are nice to know, right? So don't hit these up. Hit these first, right? Lecture notes for dispensing medications, we went over that. Week 2. Lecture notes for antibiotics, we went over that. I mentioned this, but I didn't really go over this part. So again, nice to know. They are supplemental information, but not for main information for an exam. And this week we went over antifungals, antivirals, and the HIV drug therapy update. So if you go over all of those are the high value targets. Now, what kind of, how do I know what's kind of important? Well, if it was on a quiz, right? These quizzes were created by Dr. Sysko, and I've taken and looked at these quizzes as well. They're important. They do match up the things in your lecture. So let's look at a sample lecture here, and then let's see how you can find that something's important, right? So Pharmacopeia, right? You could see it's underlined, right? Official compendium, official like listing of all the drugs. So that's an important term, right? Now, did I mention, Claude Bernard and all this? No. So don't look at this. I also went over the meanings of therapeutic versus prophylactic. Oh, look at here. You see it's also underlined, right? Pharmaconocy, it's a main topic. Natural sources. I also had these examples, and I believe these were quiz questions too. Also, I also mentioned, this is on the CCMA and the RMA. I saw foxglove and ergotamine as examples of pharmaconocy, places where natural sources, and pharmaconocy, the knowledge of drugs, right? So when you're looking through your PowerPoints, ask yourself and create questions for yourself. And one way you could do it is, you could take a typical 8.5 by 11 piece of lined paper, you fold it in half, and then could you put the question on one side and an answer on the other, and wouldn't that be a quiz? And then you keep on quizzing yourself, right? And quizzing yourself, you're actually preparing yourself for the exam. So we talked about digoxin, and think of what? Cardiac effects. Pepsin, sounds like peptidase, right? It's a digestive enzyme. Silver nitrate, remember we talked about the story about putting that cream on my burn patient. Prilosec, you've seen the commercials for gastric acid inhibitor, also known as the omeprazole. And erythropoietin, you should know that from anatomy and physiology, right? So don't you think these two things would be a nice matching section? The drug name, and a therapeutic effect. Isn't that what I said you should know for every single drug that we talked about, right? And now, did I mention like every single drug? No, but I mentioned certain drugs like acetaminophen and Tylenol. That you need to know. Mentioned alternative medication, herbal medications, nice to know. You definitely need to know who the FDA is. But did I mention any of these dates or any of that? Nope. So don't look at that. Know just what the FDA is. Know what OTC drugs are, over the counter. It goes, know what an NDA is. We talked about that, and the phases. We talked about that. So don't you think this would be a beautiful thing? A, B, C, D. Dr. Garais had an initial trial of 30 healthy people to test his new erectile dysfunction drug. And then you'll tell me it's phase 1. Well, now we're in the post-marketing surveillance for his erectile drug. And I want to take over the world by introducing my green pill instead of the little blue pill, okay? And the FDA process typically takes a long time, 7 to 10 years, okay? Right? And during this process, drugs was not tested on pregnant women, right? Because there could be a potential for teratogenic effects, and that's what this category is, right? And remember, category X, you cannot give it to a pregnant patient, okay? And then A, B, C, D, A, absolutely no risk. B, C, and D are progressively more dangerous risks, okay? What are black box warnings? We saw that, right? This too, big thing. Do you know your controlled substances? And see 1, 2, 3, 4, and 5. What's 1? We don't even use that. You cannot prescribe controlled level 1 substances. Can you prescribe heroin? Nope. But 2, right? High possibility can lead to severe dependence. Yeah, we do that. Stuff like Percocet is a level 2 drug, right? Morphine, highly will give you a lot of, but I cannot prescribe crack cocaine. I cannot prescribe heroin. Okay. Which is funny is how many times I've had patients like, doctor, can you just give me a little bit of heroin? And I'm like, seriously? It's amazing how drug addicts, because remember, they're not normal anymore. The drug is already replaced the natural chemicals in their brain. And now that person only wants the illicit drug. So when you look at that, same thing on the basic concepts of pharmacology, right? What is the main thing that drugs do for you, right? They mess with or affect homeostasis, because when you're sick, isn't that what's going on? That there's an imbalance of homeostasis, right? And all we're trying to do is to bring back homeostasis, bring back stability, bring back your patient, you know, on this little seesaw here, back to the middle, okay? Know how receptors and affinity. Remember we just talked about that with that CCR5 proteins, right? Specificity, it's specific to the CD4 cell, and it has a certain affinity or stickiness, right? And that CCR5 receptor inhibitors for as a new HIV drug, it makes it slippery so that the HIV can't do what? Can't sit on the receptor, can't go inside the cell, and can't, and you won't be able to replicate HIV. You'll still have it, but you won't be able to replicate it. Know the difference between an agonist and an antagonist. Know what does synergy mean? Okay, here's some lovely examples. And look at this: 1, 2, 3, 4, 5. 5 slides on this topic. So it screams what? It's definitely going to come out. Pay attention to those terms, right? ADME, that came out. We talked about that. Absorption, distribution, metabolism, and excretion. It's part of pharmacokinetics, or what the drug does, what the body does to the drug. And pharmacodynamics is what the drug does to the body. Dose response curve, nice to know. Bioavailability, must know. How much of the drug, if I take it, is available to me, right? And IV drugs, we mentioned, very, very dangerous for side effects, because you're putting that stuff right into your veins, right? That's why heroin addicts love the veins, because when you get the high, you push it right into your vein, you get the high as the drug is going right in you. And it's amazing. If you there's a whole bunch of like heroin documentaries on Netflix. I Netflix binge like 5 of them, because I just find all of this amazing. And also, I want to know what's going on regarding current therapeutics. But most of those documentaries are more about the human experience, and to try to, because remember I told you guys, I have a thing against, like personal thing against drug addicts, because they take away time, money, and energy away from what I used to believe were the real patients. But drug addicts are real patients. They're real people, and you should give them just as much time as you would give your grandmother, because it's some serious stuff. To the point where my mother, who's been neuropsychiatrist for 45 years in the New York City system, and also a director of medicine in 3 different jails in central New Jersey for more than 10 years. She says there are times she just wishes she can just end all of their lives because they go through rehab over and over, and they get into jail, and it's the same problem over and over again. And in Las Vegas, here's a nice statistic: 85% of all violent crime is because they're all drug related. And and remember I told you guys, my mother and I, hopefully I can convince my mother to write one more paper, maybe another book. I want to be her scribe so I can I can have some credit myself. Um, a lot of the really horrible crimes. Did you guys hear in West Virginia, a woman killed all 5 of her kids, shot them all in the head. She had a couple of shots and a couple of drinks before she did it. Right? Just imagine if she didn't take those drinks enough to lower her resistance, maybe those kids would be alive. And the youngest one was a 1-year-old. Man, that's some cold-hearted stuff. And she must have been so desperate. But you know, these are the things that, again, we were talking about mental illness. These are the things that we have to pay attention in our patient, just as much as their heart rate, just as much as their respiratory rate. Know what the words indication and contraindication means. Indication is, when do I use the drug? Contraindications, when should I not use the drug? Remember MOA, mechanism of action, right? Ooh, the little blue pill, Viagra, sildenafil. Is it sildenafil or sildenafil? I gotta look that up, right? You should not take antihypertensive medication if you're on the little blue pill. I keep on telling my patients that because it's going to bottom out your blood pressure. Side effects, drug interactions, right? Again, addition, antagonism, we already went through, potentiation, and synergism, right? Potentiation will prolong the action of one drug to another. And synergism, and we saw this in antibiotics, that will help, they're like beneficial. The sum of their individual effects help each other and help the efficacy or how good the drug works. And we saw that in antibiotics. Remember cotrimoxazole? It's a combo of 2 drugs. So when you're looking at do you see how when I went through it real quick, I can have a piece of paper on the side and ask myself, like, what's important, what isn't important? And if it's important, what can I do? I can write down a question. And you guys kind of know from the examples and from the quizzes what the question will kind of look like, right? Dispensing medications, what looks good? Know the parts of the prescription. This is how I'm going to do it. I'm going to have a prescription. I'm going to have arrows, and you're going to tell me what is it? What's the inscription? What's the sig, right? Or I can ask, what does it mean? And one of the things that what does it mean is you got to know your prescription abbreviations. Okay. Also known what RX means. If there is no RX, that means there's no order. There's no to take or take thou from whoever's prescribing it. And the only people who can prescribe medications is somebody with a DEA number. So that's either a DNP or an MD or a DO. Okay, remember DO, Doctorate of Osteopathy, right? So, but now I believe most states are expanding that because their nursing is getting more and more complex, and they're asking nurses to do a lot more, and they're expanding their role in the hospital year after year. Again, know your abbreviations. Know when to write out the whole word, and here's some examples here, right? Ooh, this always comes out on the CCMA and the RMA. The rights. Do you know, is it the right patient, right drug, right strength, right route, right time? Okay, so this definitely will come out. Be able to read the label, okay? And what labels would I use? The label's right here. So I could ask you, what is this? And you're like, oh, it's Augmentin, amoxicillin. Oh, I know amoxicillin. That's a what? Penicillin. Okay, I could ask you, how are we going to take it? Do I put it up their butt? Do I make them inhale it? No, Dr. Garais, this is an oral suspension. Okay, it goes, how much is inside this bottle? Well, 75 ml because it's fluid. Okay, and then directions. Tap bottle until powder flows freely. Okay, so I don't just open it. So I also have to tap the bottle and then I have to shake vigorously. Okay, I could also ask you, okay, what's the concentration? And you'll tell me 125 milligrams for 5 ml. Okay, so if I gave my patient 10 ml or 10 cc's, I'll be giving them 250 milligrams worth of drug. And be able to do the same thing for this. This one even has a picture. I could ask you, is this an oral suspension? Is this a lozenge? Is this a anal suppository? And they go, no, it's a tablet and it's blue and it has B on it, right? And it says here, tablet, naproxen sodium. And naproxen is also very common. It's an NSAID, right? Oh, yeah, know the roots. Oral, nasal. Look, it's even putting it in multiple choice for me, right? I want to give my patient a pill, oral. Goes, I want to give my, I gave my patient, one of those, what, I forgot what they call it. Nasal medication. They call it something, right? Like this, right? So these are nasal, like nasal cord. These are nasal medications, and you press on this little thing, and you snort it like like cocaine, right? Sorry, if that's the only thing I can think of right now, right? So I forgot what this dispenser is called. It's killing me right now. But it's of course a nasal spray. It's called something, and I can't remember it right now. Pulmonary, of course, I could use my inhaler, right? Subcutaneous, like the patch, right? Or I could do it transdermal. I mean, transdermal, like the patch, and subcutaneous, like the injection. Sorry, backwards. See, it's an injection. I could also do it IV, right? Intravenous. And which is the fastest? IV, right? Which do we typically use for vaccines? IM, intramuscular. And IV, IM, and subcutaneous are part of the parenteral, right? I always call it paternal. It's parenteral dosage, right? So that's IM, IV, sub-Q, right? And intraspinal. The best way to remember it is anything with a needle. Anything with a needle is going to go in fast, and IV is the fastest. So we got to be careful of that. Anticholinergics and anticholinergic effects, nice to know. This is good because you might see this on CMA, RMA. We always talked about very, very young and very, very old. Know the difference between active and passive immunity. You should know that from your anatomy physiology. Do not memorize the immunization schedules because they're different. They change like every couple of years, especially now in COVID. They're all ramping all this up now. Know what an allergy is? It's hypersensitivity. It's when your immune system is overreacting, right? Over the counter, how do we deal with non-compliant patients, right? We deal with their side effects. Maybe they don't understand why they're taking the drug. Maybe they have some dementia or some mental disease or defect, or they're just like me. They don't give a fudge and we're forgetful, right? E-prescribing, like all scripts, okay? Tamper-resistant prescription pads. And remember, prescription pads are crazy important. And nowadays, we have laser printers and things of that matter. I can tell you, I can easily take a laser watermark, and with the stuff in my house, I could remove the void. I can replicate pads. So if you have actual physical pads nowadays, and especially with the old school doctors, be careful. Keep that stuff locked up. But we have all scripts now, so it makes our life a million times easier. I love it. My mom even has an app on her phone if she wants to renew because I no longer have a DEA number, my mother still keeps up her DEA number, right? If I need some meds, she just plugs it right in her phone, and I'm still listed as one of her patients. And then CVS then sends me a text, and I pick it up within minutes. This technology is just for lack of a better term, amazing. I love that word, amazing. So for antibiotics, know the classifications, and in general, know the mechanism actions of each classification, right? I'm not going to go over each and every one, right? And same thing with the antifungal and the antiviral. And don't fall for that trick question. Can I give an antiviral for a patient who has a bacterial infection? I cannot. Antibiotics for bacteria, antiviral for viruses, and antifungal for mycotics or funguses. All right? So with that being said, that's what the exam will look like, right? Does anyone have any questions for the review for today?
No, I'm all set. Pretty straightforward.
Okay, so ladies, thank you for doing the extra time. And I know I was going a little bit fast, but I have it on the recording. So when you guys study later today and tonight, you guys can review what I went over. Okay?
Yep, thank you so much, sir.
All right, and think of the broad strokes, because remember, I only have 50 items. So I'm just gonna pick one thing from here, one thing from there, right? You know? So let's see, how many chapters did we have, right? We had, how many like lectures did we have? We have 1, 2, 3, 4, 5, right? So think about it. 5 times 10 is 50. So look over each lecture and go, what are the top 10 things that you'd like to say? Right?
Or what about just going back on your previous lectures and picking out the stuff you said was most important? Would that help?
Yeah, like the top 10.
Yeah.
Right? You could see easily right now from this review, my God, he pretty much spelled it out for me. Now, why am I doing this to you? Not because I like spoon feeding students, because someone has to show you how to take apart other professors. Because other professors, especially, the ones who are very collegiate, went to Harvard or wherever, right? We have a couple of those on every university. They will not review for you, right? And I will not review for you for my other classes. So please take this to heart, and I probably won't review for your final, right? So take this as a strategy on how to deal with professors, okay?
Okay.
All right, and worst comes to worst, what do? Call for help, calltutoring.com, and so they can help you prep. But I can tell you, they'll probably tell you the same thing that I'm telling you right now. All righty? So ladies, have a good one, and look out for the 2 videos today.
All right, sounds good. Thank you, sir.
All right, have a good one. Bye.
All right.